Today we'll talk about longitudinal and geospatial data. The presentation consists of some slides, and then I will walk through a demo of a tool we built, the PARAT tool, which really embodies or implements a lot of the concepts that I will discuss, or ideas that I will discuss during the presentation. I think that will make things a lot more concrete for you. And a lot of the material that I will cover also is in the process of being published. So in terms of technical details, so I won't be able to give you all the details or make it available, but hopefully in the next little while I'll be able to do so as the material makes it through the publication process. So to get started, I'll just set a bit of context for what we're trying to do. So here we're looking at the disclosure of health information for secondary purposes such as research and public health. When this data is disclosed based on existing legislation, there are, well, for research, in practice, the research ethics boards will require either that consent be obtained or that the data be de-identified. And for public health purposes, even though legislation permits the disclosure of identifiable health information, in practice we're seeing a lot of providers are reluctant to do so. So just as a practical matter, the identification of data is becoming a necessity even when disclosing data for public health purposes. On the consent side, there are some reasons when it is not practical to obtain consent. But even if it is practical to obtain consent for the disclosure of data, there's compelling evidence that consenters and non-consenters differ on important demographic and socioeconomic characteristics, and therefore you'll end up with a biased data set by going through the consent process. And by biased I mean that the consenters may have differ systematically in terms of age, sex, race, marital status, educational level, socioeconomic status, health status, mortality, lifestyle factors, functioning. There's about 12 variables that we've identified from the literature where there's evidence that consenters and non-consenters differ. So under those conditions, it's preferable to de-identify the data set before disclosure for these secondary purposes. So thus far we've done a lot of work on the identification of cross-sectional data. So cross-sectional data is data that does not have a time component to it, and essentially looks at data as a snapshot. We've done a lot of work on that, and if you go to our website, you will see a lot of material related to methods and algorithms and metrics and so on for the identification of cross-sectional data. However, not all data is cross-sectional. There's a lot of more complex data sets that include longitudinal information, which is data about individuals, and for the purposes of this presentation by individuals, I will really be talking about patients. So longitudinal data has information about patients over time, and this may be patients who have multiple visits, and then you have information about each visit over a certain period of time. Or if it's an insurance claims database, then patients will be making multiple claims over time. Under some circumstances, it is possible to convert longitudinal data to cross-sectional data and analyze it. So this is something we've seen with cancer data sets and dates. So in those cases, the date of diagnosis is taken as an anchor, and then all other dates are calculated relative to that anchor, and then the date of diagnosis is removed. And that way you still maintain the relative or the intervals among events that have occurred post or even pre-diagnosis, because you can have negative intervals. So you can maintain the interval between dates, but not have any actual dates in the data set. and because often the number of events is small or fixed, then this can be treated as a cross-sectional data set. It's not very often that we can do this with data sets. So if you're looking at an EMR data set or an EHR data set, it may not be possible to find an anchor date to compute other dates relative to that. And of course, there are many situations where there's other information apart from dates that you want to associate with these events, with these visits, or with these claims. So in that case, you really have to treat data differently as a longitudinal data set, and it's not straightforward or easy or possible to convert it to a cross-sectional data set for the purpose of risk assessment and the identification. The other type of complexity comes with geospatial data, and in practice, the data collected from patients is, at least in Canada, it's in postal codes, and in the US it would be zip codes, and a lot of analysis could be done at that aerial unit. A lot of groups we work with convert postal codes to the census geographies, like the dissemination areas, using the PCCF or PCCF plus. But for now, I will just talk about postal codes as the unit of analysis from a geospatial perspective. We're not looking at exact coordinates of individuals, so the coordinates of where the individual lives, for example. We're really talking about the aerial units in terms of postal codes for the purpose of geospatial analysis, and simply because a lot of the data sets we see are just contain postal code information. So this is the unit that we have to deal with when we're de-identifying data and trying to make it disclosing that data for secondary purposes. So I'll start off with longitudinal data. As a general statement, longitudinal data will always have or usually have a higher re-identification risk than cross-sectional data. And the basic idea is that you have an adversary who's trying to re-identify the data, and the adversary in a longitudinal data set has more opportunities to say the adversary would have background knowledge or background information they would use to identify individuals in the database. And with longitudinal data, the adversary has more information to work with, basically. So as an example, if you have a data set with multiple visits, say hospital visits, if an adversary knows the dates of 3 visits, then there are 3 opportunities there of background knowledge being used and matched against the database to re-identify an individual. There's always a question about how much background information an adversary would have, and this is an issue that will come up again in subsequent parts of the presentation. For example, let's say if a patient has had 12 visits in a year, would an adversary have information about all 12 visits, or would they at most know 5 of those visits, or 3, or whatever the number may be? So what are the limits of the adversary's background knowledge that can be used for re-identification purposes? Because it's not possible to know that precisely in advance, we have to make assumptions about how much background knowledge an adversary would have to use for re-identification. We also have to remember that with longitudinal data, multiple pieces of information may be associated with each one of those visits. So you may have a visit date, there may be some diagnoses associated with that visit, some lab tests that were ordered during that visit, and the patient's residence often is collected during the visit in case people have moved since the last visit. So you have multiple attributes per visit. It's not just the visit date, but multiple attributes can be associated with each one of those events. So I'll just talk a little bit about some of the previous work that we did in this space, and this is the idea of residence trails. And this is really was a very simple way to look at longitudinal information. And in that case, we looked at the re-identification risk if an adversary knew the location that a person lived in over time. And this was a study that was done in Quebec using data from the provincial health insurer, the RAMQ, and so we had some basic information about individuals, their date of birth and their gender, and then their residence information over multiple years. And if you've been attending some of our previous webinars or presentations, you may have seen this before, but I think it's a useful starting point, because as far as I know, this is thus far anyway, the only study that is out there that looks at re-identification risk longitudinally for Canadian patients. So I will switch to the Residence Trails tool to show you. If you just bear with me for a moment, and I'll put it up. Okay, so with the residence trails, here we had data from individuals over an 11-year period, and we were looking at, as I mentioned, the date of birth and gender and postal code. So at the bottom, the x-axis, you see the postal code information from 1 character to 6 characters, and on the y-axis is uniqueness, which is a very basic measure of re-identification risk. So uniqueness tells you whether there are any other individuals in the population who have exactly the same values as another individual, based where individual is unique on those three values. So if we look at the full date of birth, and if we look at the gender for a single year, we can see that for a 6-character postal code, this is for adults, so this is defined as 20 years old and above, about 99% of the population is unique, and I'm comfortable generalizing this to other, even though the data was collected from a Montreal-based population, we can make a case to generalize this to other urban centers across Canada. For rural centers or rural areas, the risks are not as high. So let's say for urban Canadians, 99% of them are unique on full postal code, date of birth, and gender. And of course, as we reduce the precision of the postal code, the uniqueness goes down. But let's say we only look at the year, and the year and the postal code, the uniqueness goes down as would be expected. But now let's look at the data longitudinally. So let's say over a 3-year period, if you have the 3-character postal code, it's only about 0.5% of the population is unique, but 24% is unique when you have 3 years of postal code information. And by that I mean we have the location information on those individuals at the beginning of each year. So we know their pattern of movement over a 3-year period. If you look at it over a 5-year period, then it goes up with, again, 3-character postal code. It goes up to about 33% of the population is unique. So an important observation from this is well, 2 important observations. One is that longitudinal data will by definition have a higher risk than cross-sectional data, and here we're only looking at location information, postal code information, but when you start adding other events, then the risk can go up quite dramatically. And also that the rate of increase of risk tends to slow down. So from 1 year to 3 years, there's a big jump in re-identification risk, but from 3 to 5 years, there's a smaller jump in re-identification risk. So by adding a year to a longitudinal data set, it depends where you add the year. Is it you had 3 years and you made it 4 years, versus you had 1 year and you made it 2 years, because the jump in re-identification risk does matter. So this gives you a sense that longitudinal data can increase the risk of identification significantly. So now I will, and for youth the results are similar, not exactly the same. Youth would be lower than below 20 years old. The re-identification risk for youth tends to be slightly lower than for adults, but the pattern is exactly the same, and they're still quite dramatically high. based on these basic for these basic demographics. And by the way, this website is public, and there's a link that I will send out with the materials past after this webinar, the materials for this presentation. So now let's go back to the slides. So the previous work we did on residence trails was that. Now when we talk about longitudinal data, we first of all need to think about how to represent the information. So let's say we have a basic data set of patient visits, and so we represent each patient as a tree, just conceptually. So here we have an individual at level 1, and yet they have a date of birth and their genders, and level 1 is information about the patient that's fixed, that does not change over time. So this is essentially the fixed non-varying component of the patient information. And then for each patient they may have multiple nodes at level 2, and in this case each node pertains to a visit, and you have a visit date and a postal code of where that patient lived during that visit. And that way you can have multiple nodes at level 2 representing multiple visits and multiple attributes associated with each node. Conceptually, you can also have multiple levels, more levels than 2. You can have 3 levels, and level 3 could be diagnosis codes, for example. So if a patient has had multiple diagnoses per visit, then you can have those added as a level 3. But for now, we're only limiting our discussion to 2-level data set with basic demographics, and then a level 2 component with the attributes that exist at each event over time. And this event doesn't have to be a visit. I mean, it can be, if this is a claims database, then these can be claims, and each claim may have, it will have a date. In this case, the claim will also have a one up to a maximum, say 5 or 20 diagnosis codes, and there may be payment information related to the claim, and so on. And just another observation, I mean, this way of looking at things doesn't necessarily apply to longitudinal data only. So one of the projects we work on relates to the birth registry, and so you can have a mother at level 1, and then if she had multiple babies or multiple births over time, then again, you would, although it's not really longitudinal data, having multiple births related to a single mother, you can represent the data this way, and from a re-identification risk perspective, you'd analyze it in exactly the same way as you'd analyze longitudinal data, except that it's not really longitudinal. But for now, we'll just limit our discussion to longitudinal data. So an example of a data set, a longitudinal data set, would be, when you represent it as tables, would be like this. So here we have 6 patients with a patient ID from 10 to 15, and for each patient we have a date of birth and a gender. That's in the table on the left, and then the table on the right we have the visit information, and for each patient they can have 1 or more visits. So patient number 10 had 3 visits, and for each visit we have the visit date and the postal code that the patient lived at during that visit. So essentially a very simple 2-table representation. And again, as I mentioned, you can add many more fields to either of those tables. It does not actually, it does not matter how many fields you have, and so on. But when you do the analysis or think of longitudinal data, at least using the tools that we've developed, you'd have to represent the data as 2 tables that can be linked through a patient identifier and possibly a visit identifier as well. So we've done quite a bit of work on longitudinal data de-identification, and we've been working on this problem for some time, a few years now. We tried many different things, and we've developed a number of algorithms which I will show them in operation shortly. So I just wanted to show you some of the evaluation results that we've done. So there are as I mentioned before, there are a number of different assumptions one can make about the background knowledge of an adversary. So one assumption one can make, which is the most conservative assumption, is that an adversary knows all the level 1 data. So we can assume that, let me go back here, we can assume that the adversary knows a patient's date of birth and gender, and also the adversary knows about all the visits and all the values for those visits. So it knows that there was a visit on the 1st of January 2009 with this postal code where the patient lived in that postal code. There's a visit on the 14th of January 2009 where the patient lived in that postal code, and so on. So it knows every visit and all the attributes associated with each visit. This is a very conservative assumption. And it assumes that the adversary has a huge amount of background information about the patients in the database. They basically know everything. They know all the basic demographics and level 1 data, and they know all the detailed visit information about all the visits. In practice, this is unlikely to be the case. There are not many situations where an adversary would know that much information about an individual and use that information to re-identify them. And if an individual has that kind of that level of detail of information, then they probably know all the clinical information as well. Or they'd have access to a clinical database which contains all the visit information, and they wouldn't need to re-identify the data set anyway. But this complete knowledge assumption is a good baseline. So if you start off from that and say this is the most conservative assumption for an adversary knowledge, then that we can use that as a baseline, and we can look at the re-identification risk for that, and then we can look at how much information loss you would have when you de-identify a data set making that assumption or protecting against that kind of adversary, the all-knowing adversary. And then we can start relaxing that assumption. So that one subsequent level of relaxation would be an adversary still knows all the visits, but does not know which attributes go together in the same visit. So I'll go back to this example. So an adversary may know that patient number 10 had a visit on the 1st of January 2009, and they may know that they lived at these two locations, K7G 2C3 and K7G 2C4, but the adversary will not know that on the visit on the 1st of January the patient was living at the 2C3 postal code. Also, the adversary will know that the patient had a visit on the 14th of January, but will not know which postal code they lived at, or which one of the two postal codes they lived at during that visit. So they have all the individual pieces of information for all the visits, but they're not able to link them or put them together on a per event or per visit basis. So this is one way one relaxation of the assumptions, and we can take that idea of relaxing the assumptions a long way, and we've developed a taxonomy of possible assumptions about the adversary. But for our purposes today, we'll just assume that the adversary has information about all the visits, but doesn't know which attributes go together per visit. And then we have the baseline and the kind of more relaxed assumption of the adversary, and then we built a number of algorithms to de-identify the data set, which I will show you, and we looked at how much information loss, how much precision we lose in the data when we de-identify the data that way. And a commonly used metric for information losses is entropy. And there are many good reasons why entropy is preferable to other metrics. And we evaluated it on the state and patient database for 4 states, 2007 or 2008, depending on the year: California, Florida, New York, and Washington. And these are very large longitudinal data sets. And here we can see the reduction in entropy compared to the baseline from using the relaxed assumption about the adversary. And the key point here is that there can be a huge reduction in entropy, huge reduction in information loss when we modify the assumptions about the background knowledge of the adversary. So there is the baseline assumption about the all-knowing adversary, I think, is somewhat unrealistic. It's very conservative and will result in a lot of distortion to the data. And by making some modest relaxations of that assumption, you can have a huge reduction in information loss and get much higher quality data, which is essentially what we've done. We've relaxed the assumptions, and we developed algorithms that will de-identify against an adversary who still knows a lot, but not the all-knowing adversary. And so the assumption we ended up using for practical reasons, because it's very realistic. It still assumes an adversary with a lot of information, but doesn't know absolutely everything, including all the attributes for every single visit. And we call this the incomplete knowledge assumption, which is the assumption that we'll use for our examples. So now what I'll show you is I'll walk you through an example or a demo of the PARAT tool and how we implemented this identification of longitudinal data using the incomplete knowledge assumptions, or adversary with incomplete knowledge. Okay, so what you should see now is the screen for the PARAT tool, and I'll start off by loading a longitudinal data set, and this is a very simple data set. It has, let me zoom in a little bit. So the data set has 3 variables that we're interested in. This has the patient identifier and visit identifier, as you would see in a normal EHR, EMR data set, but also we have the gender as the level 1 variable, and then we have the visit date and the postal code as the other level 2 variables. These are the attributes characterizing each visit. So I will completely ignore the longitudinal nature of this data set, and I will de-identify it as if it is a cross-sectional data set. And the point of this exercise is to show you why applying cross-sectional data identification to longitudinal data will give you incorrect results. Not just bad results, but incorrect results. So we'll do the risk assessment. Oops. Let me select my variables first. So these are the 3 variables: the gender, visit date, and postal code, and then we'll do a risk assessment. On this cross-sectional data, we find that in this case about 99.8% of the records in the data set are high risk. There are about 10,000 records in this data set. So we will go ahead and de-identify this data set. So I'll just keep all the default parameters for the de-identification. And the way we do the identification in the PARAT tool is using hierarchies. So it's essentially applies generalization and suppression. So we will define a date hierarchy for the visit date. So you have the full dates, month, year, quarter, year, and then we'll have a postal code hierarchy. 6 characters of postal code to 5 characters, 3 characters, and 1 character, and so on. And then I'll just de-identify this data set. Actually, let me call this the cross-sectional de-identified data set. And then this will. So this is a longitudinal data set, and it ran the de-identification, and the results here were the gender is unchanged, the visit date is quarter to year, and you have the first 3 characters of the postal code. And it shows here that from a cross-sectional perspective, it seems like the risk is very low. The problem with doing that is you'll have multiple records belonging to the same patient. And if you don't take that into account, there's this dependence among the records in the data set. And if you don't take that into account, then you may actually be underestimating the risk. So what I'll do now is I'll go back to our data set, and I will treat it as a longitudinal data set. So actually, let me go to the data set we just de-identified. So this is the data set we just de-identified, and I'm going to treat it as a longitudinal data set and measure the risk. So for a longitudinal data set, we have to specify the 2 tables. The level 1, so the identifier is patient ID, and the variable at level 1 is gender. And then at level 2, we have visit date and postal code. So this is essentially specifying the variables at level 1 and level 2, and this is the same data set on the right that I just de-identified, right? And so if we measure the risk on this data set, we find that 50% of the records are still high risk. So the key point here is that if you take a longitudinal data set and ignore the longitudinal nature of it and apply existing data identification algorithms to it, which really only work on cross-sectional data, you will underestimate the risk dramatically. And in this case, we see that the true percentage of records that are high risk is 50%. When we take into account the fact that each patient has multiple visits, whereas when we did the analysis, ignoring the longitudinal nature, we thought it was 0%, which is incorrect. So this emphasizes the importance of if you have longitudinal data, you really have to apply longitudinal data identification algorithms on them in order to make sure that you have de-identified them properly and that your risk assessment is correct. So now I'll go and de-identify this data set properly. So I'll again load the longitudinal data and define the levels as I showed you before for level 1, and then do that for level 2, have the visit dates and the postal codes. We'll do the risk assessment. We'll see that the risk is very high. We'll do the de-identification of the longitudinal data by specifying the hierarchies for each variable. So we have here the date and the postal code, and then call this longitudinal, and then do the de-identification on that. And here we will get a different answer in terms of the amount of de-identification that needs to be applied. And again, as I mentioned, this de-identification assumes this incomplete knowledge or incomplete background knowledge of the adversary. And this takes maybe 20 seconds or 30 seconds to complete. And then the final result, as you will see, will be different. So the when we applied the cross-sectional data identification, we had the visit date generalized to quarter year, and the postal code generalized to 3 characters of the postal code. And here is the result when we did it properly using using algorithm that's suitable and recognizing longitudinal nature of the data. We had quarter year and the first character of the postal code. So actually the geography was reduced further, and the risk here is the correct 0%. So that's basically how it works. The longitudinal data algorithm, as I mentioned before, performs generalization followed by suppression, and there are actually 2 different techniques used, one for generalization, one for suppression of longitudinal information under this assumption. Now we've applied some of these techniques to the Heritage Health Prize, which you may have heard of, which is a large competition that was run by the Heritage Provider Network in California, where they posted data on 113,000 patients' longitudinal data, claims data over 3 years, with the purpose of for the purpose of the competition, and the competitors or entrants are supposed to predict future hospitalization of these individuals, and whoever builds the best and most accurate model gets $3 million cash prize. So we essentially used methods similar to this in the de-identification of that data set. We made some additional assumptions there, in that the adversary did not have information about all the claims, but only a subset of the claims. But it also made the incomplete knowledge assumption. So we actually applied this tool to a very large data set. And apply these algorithms to a very large Heritage Health Prize data set, which is 113,000 patients. Ended up being close to about 10 or 15 million records, claims records for these patients. Okay, so I'll leave it at that for longitudinal data, and then I'll switch over to the second part of our presentation, which is geospatial information. I'll switch back to the presentation now. So for geospatial information, again, another adds another layer of complexity. And as I mentioned before, the most common information that's collected, at least from EMRs and EHRs, are postal codes. These can be converted into census geographies like dissemination areas for the purpose of analysis. But for now, I'll assume postal codes, they do have disadvantages in terms of they change over time, in terms of the number of postal codes and their boundaries, but also the postal codes are really defined for the delivery of mail, and they may not be meaningful beyond that. So often analysts would convert them to the A's, but for now we're just focusing on postal codes. Let me just see here. Okay, so just to give you a sense of postal codes in Canada, postal codes are small. The median, the 50th percentile for postal codes in the various provinces and territories, it's around 20 or so. They're not very large, although as you can see, the maximum population size for postal codes can be quite large, going up to as high as 17,000 for postal code in Ontario. But by and large, the median value is quite small. In urban areas, they tend to be very small. They're much larger in rural areas. The problem with small areas is that the risk of identification can be high. So as you collect more information about individuals who live in those small areas, they begin to stand out. So there's only one 80-year-old lady living in this postal code, for example. And if you add other socioeconomic factors, you start narrowing it down further. Although at the postal code level, there's a good amount of homogeneity within postal codes on the socioeconomic variables, but still there is some variation. So when you're talking about areas that small or populations that small, a few other pieces of information will make these individuals unique, or put them into very small groups, which increases the risk of identification significantly. This applies more so for urban populations rather than rural. So this is a box and whisker plot for the provinces and territories. Let me try to. Actually, I can't zoom in on this, so I'll try to walk you through it. In the bottom row, the second one from the right is Ontario, and the plot on the right-hand side is for urban populations or urban postal codes, and the one on the left-hand side is for rural postal codes. But as you can see, the median value for rural postal codes is around 1,000, and for urban postal codes in Ontario, it's around 20. So there's a dramatic difference in population sizes at the postal code level between urban and rural populations. So really the risk will be much higher when you're collecting data or disclosing data for urban populations. The most common way to deal with postal codes during the identification is to crop them. So this means removing characters at the end. So you have a 6-digit postal code, 6-character postal code, you remove the 6th character or the 5th character, or 5th and 6th character and so on. So you essentially crop from the end and reduce this. And because they're hierarchical, so the areas, let's say if you have a 3-character postal code, then that's a superset of all the other areas that have 4, 5, or 6 characters. So cropping works in this particular context, and that's one way to create larger areas in order to deal with the privacy problem. The problem with cropping, though, is that you end up with very large areas, and from our experience doing this for quite a while, and as you saw in the previous example, we ended up having to remove a lot of precision in the postal codes. You're reducing it to 3 or to 1 character in order to maintain our re-identification risk levels using cropping. And cropping tends to do that. It results in a reduction in precision or enlargement of areas so much that it's very difficult to do any detailed analysis for small areas. So we wanted to look at this issue and try to come up with a solution. Um, so here's an example of cropping, and the percentages show you. This is based on the Ontario Birth Registry, an example from 1 year, just the data set that we've quite familiar with. To show you the percentage of records with a high risk, and we use the 0.2 threshold here. And if you look only at postal code, and this is birth for 1 year, 69% of the records in the database would have a high risk with a 6-character postal code, but as you crop to 5-character and so on, the risk would go down. However, when you add age to postal code, even when you go down to 3 characters, so this is just postal code and mother's age, 97% of the records have a high risk with the full postal code, but as you crop it down to 3 characters, still 9% of the records have a high risk when just with those 2 pieces of information. Now, if you add other things like the baby's date of birth, the language spoken at home, and as you add more information about the baby and the mother that can be used for identification, the reduction of 3-character postal code may be insufficient. You may have to cut it down to 2 characters or 1 character, and at that level it's really not very useful geographic information anymore. So what we basically did was develop an aggregation algorithm, and then what this essentially does, it takes the postal codes and grows them. So for each postal code, it looks at the adjacent areas and tries to find an optimal way to group them such that the areas are larger, but they're only large enough to meet certain privacy or identification risk thresholds. So this is essentially the idea with aggregation. So rather than cropping postal codes, we grow postal codes. This has advantages and disadvantages. The advantage is that you get much smaller areas at the end, and I'll show you in a moment, that still meet your identification risk thresholds. The disadvantage is you may end up with the geographies you end up with are not your regular geographies. So they may not match any municipal boundaries, for example. I mean, these are all solvable problems, and we're working on solving them. But as of today, the aggregation is done to ensure that the areas are as localized as possible, and they're large enough to meet the identification risk threshold. And I'll show you an example of how we implemented this in the PARAT tool. So I'll load it's a very simple data set just to illustrate, and this data set only has the postal code. So I will run the cropping on the postal code data set. So this is a cross-sectional data set. We'll do the cropping on it. With just postal code, about 36% of the records have a high risk of identification, and I will define a postal code hierarchy here, and I'll just ask it to find the cropping level that satisfies our threshold. And as you can see here, the first 3 characters of the postal code are retained, and that ensures that the risk of identification is 0. Now, if we do the aggregation here, and so basically here we're telling it that to treat this field as a postal code rather than as a variable that it would crop, and do the identification again. So now it's doing the aggregation, and this will work when you have multiple fields as well. So you can have age and gender and any other information, so this is again with the result with aggregation. You also get the de-identified risk. The risk is at 0, but the main difference, or one difference, will be here we have about 260 records that would have to be suppressed without aggregation, and with aggregation no records were suppressed. So the difference is that with aggregation it will always create data sets that are meet the risk criterion. So you'll never have to suppress any values, or you don't. I mean, it's an optimization problem, so it may suppress. You may have suppression in your other variables like your date of birth or gender or some other fields, but the amount of suppression will be dramatically less than if you do cropping. And this is a simple example that illustrates this. In one case, with cropping, you end up suppressing, a good percentage of your data set, and with aggregation, you don't have to do that. When we plot. So now we have we've done both types of geographic de-identification, and here I've taken just an example from Northern Ontario to show you what the difference would be. So here is the FSA. So here's an area with 4 forward sortation areas. These are 3-character postal codes. So this is what you would get with cropping. The optimal solution, the example that I showed you, was 3-character postal codes. And so this is what it would look like on the map. And then with aggregation, here are the areas that our aggregation algorithm has created. Again, it's still combining postal codes, but as you can see, the areas are much more localized and smaller. That you get much more specificity than with FSAs. And again, so that's one benefit, and the other benefit, of course, would be that fewer records would have to be suppressed because it optimally selects the geographies to minimize that as well. So again, this has been implemented now into the PARAT tool, and of course, things get really interesting when you start having geographic information when you apply aggregation to longitudinal data. And this is where I think you start getting some incredible benefits in terms of data quality, in that the amount of information that can be retained can be quite significant compared to any other methods that you would use to de-identify that data. There are no methods really to de-identify that data well anyway, but if you try to do it using cropping on longitudinal data, you would lose a lot of detail, whereas if you use aggregation on longitudinal data, you start getting a lot of the benefits from using these algorithms, in the sense that you get higher quality data, more precision, and you lose less information. So I'll leave it at that, and I'll start taking questions. At the end, when I give you the slide, so here's the contact information. You can send me questions afterwards, and there's our website where you can get more information about this work. In the slides that I will send you, there's some references as well for some of the publications that try to address this. And I'll go now to the question area, and you can start typing your questions, and I'll respond to them in over the next 10 minutes. Thank you. Okay, so first question was, who do you typically think of as adversaries? Hackers, or just someone trying to prove a point? That's a very good question. So we did a review of all known re-identification attacks, and there are 14, at least up to October of last year, which was when we completed the review. There were 14 published re-identification attacks that were successful, and 6 of those were on health data, and the vast majority so 12 out of the 14 were demonstration attacks. So these were essentially people who were trying to prove a point, and 2 of them were done in the context of court cases, or mentioned during the court cases. One of them was actually an expert witness doing it for a court case, and the other one was a broadcaster. I think that a large amount of known re-identification attacks are people just trying to prove a point, to make the point that it's doable. However, we can't rely on that assumption when we're doing the risk assessment for de-identification. So the typical process is to look at what our publicly and semi-publicly available databases are that can be used for re-identification. And then we would typically consider other organizations that may have access to data that they can use for matching. So if you're releasing a health data set that contains lab information, we'd think about the commercial labs and whether they would be in a position to re-identify insurers. If they get access to the data, would they be in a position to re-identify? And then we'd look at acquaintances, the circle of acquaintances of individuals, like their neighbors, their co-workers, their ex-spouses, relatives, who may have some information about them and use it for re-identification. The vast majority of re-identification attacks, the proportion of records that were re-identified across all known re-identification attacks is less than 0.5%. So most re-identification attacks were re-identified a very small number of people, in a lot of cases just one or two. But in practice, re-identifying one or two individuals in a database and having it at the front as a front page of a newspaper can cause a lot of damage. So, so this is why we also look at the circle of acquaintances of individuals and try to manage that risk as well. Can you explain how you grow postal codes? So we've developed an optimization algorithm that does that. We have a paper that's in the process of being published now describing this algorithm. But it's essentially an optimization problem. I'm optimistic that the paper will be out before the end of the year. But essentially the tool that I showed you implements that algorithm. We have some ideas on improving it, so we are working on those improvements. And I mean, in practice, the publication cycle is slow. The tool will have the implementation 6 to 12 months before the publications come out. But essentially, we use optimization methods in order to determine which and various heuristics to determine which postal code to combine, which postal codes to combine in a data set. And it's done for the different types of risks that we manage. So we look at 3 types of risk. We call them prosecutor, journalist, and marketer risk. And the way it's done will vary by the type of risk you're trying to manage, but the basic principles are the same. The next question is, can this aggregation software be built into a real-time surveillance system that is harvesting information from an emergency department admission system? Yes. The way we've implemented it, it's a complex optimization problem. We've implemented it in a way to make it work real-time. So as you see, we get the results almost instantaneously on good-sized data sets for the geographic aggregation. So I would say yes, this can be done in real time for quite large data sets. And as I mentioned, the specifics will depend on what type of risk you're managing. But essentially, we've tested this on very large data sets. We've constructed the kind of intermediate results for all of Canada, for all the provinces. So that way we can do the aggregation very, very fast and in real time. Okay, so I think we're also, I'm not seeing any more questions coming in, and I think we're also running out of time. So I will send you emails with the material from the presentation and the recording and so on. If you go to the website, there's a you can subscribe to our mailing list, and as soon as the material comes out, the description of the algorithms comes out, then you'll be notified right away, and you'll be able to see. So this is really a sneak preview on what it actually does and how it operates. The other thing I would mention is that we are implementing this for dissemination areas as well, and I'm hoping to incorporate that into a future release of the tool. And if you're interested in working with us on that, I'm always happy to collaborate. And also we have a large project where we're doing this for in the US as well. We're initially starting with ZICTAs and implementing the aggregation for to work with ZICTAs. So we are continuing to work on the aggregation issue and trying to work with different communities. The biggest one that we received the strongest reaction from was the public health community. So we're trying to work with the public health community to improve this algorithm, and for example, by creating areas with homogeneous socioeconomic status, as well as meet privacy criteria. So there are various other constraints we can impose on the aggregation that will meet the needs of particular communities, like the public health communities. So hopefully hopefully I'll be able to show you some of these results before the end of this year. And with that, I'll finish the webinar and just want to say thank you very much. And I think this will be the last webinar for the summer, and we're starting again in September.